The limb amputation is something that's very devastating for a patient, and it can be not only physically devastating but emotionally devastating.
It's just very difficult to get over the fact that you've lost a limb.
The surgeons here recognized early on that there was some responsibility to the patient to try and make sure they were providing as comprehensive of a care as they could.
Well, amputation is our last effort on every patient, but it's very true that a good amputation is better than a bad foot, and people will often go for long periods of time with a lot of pain, a lot of sores that won't heal, whereas if amputation is the appropriate option at that point, once you get that healed, you get them ambulatory on a prosthesis, it changes their life again for the better. We have kind of a unique situation where we had the surgeons and the prosthetists working together.
The typical relationship is the prosthetic provider is a vendor, and they come in and do whatever it says on a piece of paper. And here they actually asked, what could we do better to help your patients and help you?
And to be honest, I mean, this has been a game changer as far as amputations and post-operative care in my time during surgery.
We come in before surgery and we kind of lay the roadmap for them and explain to them that this is not the end of the world. It's the next step, it's the next phase in your life.
In conjunction with them, we've learned and developed some special procedures in terms of muscle coverage of the stump and how to keep the muscle a little healthier so that the push-pull in the prosthesis is easier.
The loss of a limb is equated to the loss of a loved one, so this is a very emotional time for an individual, and it's a very scary time. It's very frightening because they just don't know what's coming. No one wakes up and says, hey, I'm going to have my leg cut off today or my hand cut off today.
It is a new way of living your life. We tell patients often that you'll do everything you did before, you'll do it in a different way, and you'll put a leg on in the morning to do it. That's why I think it's good that we have a number of amputees on staff, both male and female.
I typically will wear pants and I come in and ask them, can you tell me which leg I'm missing? Then I pull my pant leg up and it blows their mind because they don't realize I'm missing both. We want to do our best to get that patient up and walking as soon as possible because the quicker they get up, the more the success they're going to have with using a prosthesis.
When we started here 10 years ago, there was basically two types of surgeries done, a below knee amputation and above knee amputation. Now we offer the patient 6 different types of surgery. That would be more customized to what that patient wants to do. Taking into consideration all of the things that affect the patient's life, where they live at, how old they are.
I've been an amputee for 8 years. I've done everything from just the simple locomotions of getting up and walking for the first time all the way through finishing a half Ironman. So obviously I think we're experts here. I know we're experts, and we definitely see all kinds and are able to help all kinds because we put forth that extra effort it takes to really help the individual out. If we have an opportunity to share our experiences as well as help them cope with it, then we feel like we're doing a better service than anyone else out there can do.
There's really nothing better for a patient than who's looking at, oh my God, what's going to happen in my life, to see some relatively healthy looking person who in our cases are running marathons and climbing mountains and doing all kinds of things. That gives them a new perspective and a lot of hope for the future and a lot of impetus to, okay, if we're going to have to do it, let's do it, and let's get going on the prosthesis and getting walking again.